I saw it good to talk about immunity because I'm told cholera is in town. And when cholera is in town, it means our immunities are at a compromise, that we can get that thing anytime. Now, this is when, in the medical field, I know we've got lots of medics in here. When or if you ever get cholera itoje kwa Kiswahili? Kipindupindu. Ikiwa utashikwa na kipindupindu au umeshikwa na kipindupindu, basi umekula mavi. No, it's important to tell you that. Umekula mavi. Kwa sababu kipindupindu hakitakuja kutoka kwa mkate au kwa keki au kwa bia. Kuna wale tunaenda, cholera is in town. And when cholera is in town, there are some key things that we need to look at. More especially when you are associated with me in BF Suma. Number one is your immunity. Number two is your digestive system. That digestive system, how do we look at it? Digestion. Because the feces, I used a very rough term so that you can understand what I'm talking about. The feces, will eat the feces from the foods that we eat. And what type of foods are we talking about? All sorts of foods. More especially those that have not been cooked. Apparently, even those that have been cooked can be contaminated and we can get what? We can get kipindupindu. Where does it start when it comes to ingestion of that food? It starts from preparation of the food, right from cleaning it. Now, when we are cleaning that food, how clean is the water that you are using? BF Suma has a solution to that. I normally give an example of fruits that I've always taken home so that nisiulizwe maswali, called grapes. And I give an example of a packet of grapes to be like that. That's how that package is, which will be around 300, 400, 500, depending on where you're buying from. What we do, we buy the grapes, go home. If you have young men and women like what I have in my house, either madam or yourself as a mzee. In this case, let's talk about madam. Utaenda ufungue tap, shwa, upitishe pale ndani ufanye wa, alafu wekelee mkono hivi, maji machafu yafanye nini? Yamwagike. Tena ulize, wa, tena umwage maji yatoke. And then immediately you will pick two na urushe kwa mdomo. When you went to buy grapes, I'm sure that's when you'll also go with a kibuyu cha maji ya kunywa. You go and buy some water, drinking water. When you buy that drinking water, what happens? You will go home and get a water dispenser, weke ule mtungi pale. And right now, since these guys are at home, who happen to be our kids, you will warn them, hayo maji ni ya kunywa, msichezee, mumesikia? Watasema, ndio mama, tumesikia. So they will make sure that hiyo maji ni ya kunywa. But here you have washed those grapes, na ukachukua 2-3 ukarusha kwa mdomo. Umeosha kutoka kwa tap. Ile tap, yale maji haujui yametoka wapi. Mtu akikuonyesha picha ya yale mabomba ni pipes. I told you nowadays Kiswahili nina kitema, so if I mix, ukisikia nasema mabomba, tafadhali niwie radhi, mimi ni mcoast. Yes. Yeah, nina damu ya ucoast. Kwa hivyo mtaniwie radhi. That if you look at those pipes which were installed several years ago, you'll be shocked. You will be shocked by these pipes in there. And that is the same water that we get to dunge mdomo pale tukunywe and we say we are fine. Why? Once you've taken that water, we know it's raining now all over the country. And with that raining, I asked somebody a question about some buildings I saw somewhere. And that town, I'm told the drainage is very poor. Not I'm told, I've even seen. Used kunyunyuzia zile mboga ili zionekane green. The water that will be used to be packaged into bottles that will take what we call mineral water. How mineralized is the mineral water? We'll take and behave around that. We have taken it. Ole wetu kwa sababu cholera is in town. Now, how best can we clean that water? BF Suma has a solution of a product called what? Pure Well. Pure Well is like a small gadget that you fix in your tap at home, and when you open that water, the water is filtered. There are some elements in there that will filter the water and take down those microbes so that you have safe water for usage at home. When you have safe water for usage, then that water you use it in cleaning your grapes. As you're giving your babies, those abdominal pains will disappear. I normally feel so good when a client comes to me with a child whose stomach has always been there. A child who is 5 years, 8, 10 years, whose stomach has never kept quiet. These kids, at a tender age, they have had 3, 4, 5 endoscopies to try and find out what the problem is. The problem is me and you, who will go get those grapes, clean them in that shoddy way, and give them. You'd rather put Omo in there and clean those grapes if you are to do that. Otherwise, you'll be feeding them now. I've always advocated for salad. Salad are greens. Unajua kuna wale wanajua cabbage ni greens. No. Hata sukuma wiki ni green. Yes, a salad that will be done. Kwamba utaenda pale ni kitchenini ama ni chickenini, alafu utasema niwekee two pizza na tule tu cabbage tumewekwa pale. How clean is that cabbage? How clean are the salads that we eat? And that is how we end up getting cholera. Cholera is real and is in town. The first step is by taking care of the water that we are using, by cleaning our vegetables, our fruits, and even our hands. Cleaning our hands. Cleaning hands. I chased somebody away in my clinic in Mombasa, whom I gave a sanitizer before he touched my machine. Alipokataa nilimwambia, okay, kanyaga mbele. Alifikiri ni mchezo. Nilimwambia no. Kama wewe ni mchafu kiasi hicho, basi wacha nibaki na usafi wangu. Mnajidai, nikamwambia wacha tuendelee kujidai na tutazidi kujidai. Let us clean our hands nicely. Let us clean the vegetables that we are using. Let's clean the fruits that we are eating. Those fruits that you'll pick there and you'll eat them, you are crunching them. If you look at, anybody can go to Mr. and Mrs. Google, look at the shape of that cholera. Pale nyuma imejengwa ni kama what do you call it? Like a piece of a stool. Good. That is cholera for you. Digestion. Number 2, let us make sure that we are on what we call Consti-Relax. I'm giving a prescription for cholera. Number 1, we have talked of Pure Well. Number 2, Consti-Relax. And Probio 3, good bacteria. Probio 3. Consti-Relax, we do 1 times 2. It's a paste. A paste is liquidish, and Probio 3 is a powder, good bacteria. 1 times 1, these ones, you can mix them together, not a problem, in half glass of warm water. No, natakia niende costo. My handwriting changed. Half a glass of warm water. Let it be warm because these enzymes need to be activated. Activation calls for warm water, not hot. When it's hot, it denatures them. We want them activated so that the system is well taken care of. And then, this is number 3. Number 4, we give these guys what we call pure and broken Ganoderma spores. Pure and broken Ganoderma spores, we'll be looking at it here. We'll be discussing about it. Pure and broken Ganoderma spores made from some special type of mushroom whose work is boosting our immunity. In other words, making the system strong so that it can be prevented against these conditions that are bound to affect it. Pure and broken Ganoderma spores. And then give these guys what we call anti-DA. Anti-DA. Anti-DA is made from red bamboo. They are pellets. Those 2 things, they can take 3 times 4 or 3 times 2 or 3 times 3. But if that diarrhea is severe, give them 4 pellets times 2. Wanaweza meza kwa maji au wamumunye. It has got very good anti-acidic effects and also slows down the peristaltic movement. Peristalsis ni ile kujikamua kwa utumbo unaposongesha chakula mbele. Kwa hivyo, what makes again diarrhea be severe is because of uncoordinated kind of peristaltic movements in our gut, which makes that gut smooth and everything that gets in gets out as soon as it gets in. And very lastly, let's do these guys a favor of giving them what we call Zaminocan, which has got zinc, calcium, amino acid, and selenium, so that it sorts out the nervous system, so that the peristaltic movements are well coordinated. That zinc is good to the nerves, and calcium also works on the muscles. We say there will be poor contraction and retraction of the muscles. Even that digestive system has got muscles that have to be controlled so that the stomach contents can go down pole without causing much issues. If the diarrhea to an extent that the anal area is red in color, yani ametokwa na ngozi pale chini sio kwa kesani, kwa kisi tunaita kesani hapa, hii kwa mguu hapa, hii ni kesani. I'm not talking about there, I'm talking about the anal area. Do you know you can diarrhea mpaka it, you know when you are going there you don't need to wipe. Unajua vile dada wanajipanguza kuwapatia soup. That's how you do down there. When it's hot like that, please give them a very special thing called what? What do you call our toothpaste? Dr. TS. Dr. TS. This is a toothpaste, but has got some very nice soothing effects, especially to wounds. But when they are using it, they also have to be careful. Asiende akafinyia hapa alafu urudishe kwa ile glasi kwa juu ya fridge. No. With very clean hands, kafinye kaweka kwa mkono, toka ukipiga pinya, ujifinye kwa choo, uchukue na kidole upake. That pain, that discomfort will have been sorted out courtesy of what? Dr. TS. This is a nice prescription for somebody who is struggling with cholera. We've said cholera is in town and it's taking down our people in numbers. That takes us back to our discussion. What are we talking about? Now, we have talked about this, the products that we'll be looking at as we are sorting out our brothers and sisters who are suffering with cholera. That's how I look like when I'm not in window bed. So this window bed sometimes can mess us up. Low immunity. Kinga ya mwili. What is immunity? The ability of the body to protect you or prevent it against illnesses. Let me say, immunity is the defense mechanism of human body. It is the ability to identify. Identity has to be there. And eliminate any foreign objects, that is viruses, bacteria, we have fungi, plus many other things, and even the generation of body's own cells. And also to identify and treat mutant cells and viruses. Mutant cells are the cells that can easily turn into, to be cancerous. So, with a low immunity, direct symptoms is easy to get sick. That's those people who are prone to illnesses. Kitu kidogo jamaa shagonjeka. Infected, inflamed, or fatigued. Ule uchovu, that fatigability, if it's high, then your system is weak, that you can get any disease anytime. Also, probability of suffering from various diseases also becomes very high. And also, indirect symptoms will be faster aging. If you find that you are aging at an alarming rate, then there's a problem. If your kid came home from school, ukapata anazeeka vile hata wewe hukumtarajia, basi hata kinga yake ya mwili iko chini. You need to talk to them so that their immunity is good. We sort them out in that manner. Low immunity has shortened the average life expectancy of Africans by 17 years from the global average. We are talking about Africans. When we look at our brothers from the other side, without mentioning names, you'll find that it's higher than ours. Why? Because of our ways of living, because of the foods that we eat. Now, do you have the following symptoms? 1, easy to catch a cold and illness, long-lasting. I know men, when I'm talking of men, I know the Bible talks of men as me and who and even ladies, but I'm talking of the three-legged human beings, men. Hapa ndio huwa tunaanguka. Kwamba kahoma kakitushika huwa tunalilia mvunguni. The cut is difficult to hit, that you can get a cut and healing takes long. Then our immune system is low. Ineffective after taking drugs. That you take drugs, but they're not helping you. You take the best antibiotics whenever you have a given condition, but then the healing process takes like forever. Usually feel tired and lack of energy. Energy is produced by the cells of the body. And these cells, which I've always drawn like a cell in a very simple, easy way, that we have that cell there. And with that cell, it has got its nucleus, which is its command post. We have what we call the mitochondria. Somebody told me that my mitochondria is becoming shorter every day because I'm making a lot of noise. That energy will be generated from that cell. And For energy to be generated in there are so many factors that have to be put right. Number one, blood flow through that blood vessel, which will help oxygen get in here nicely, because it's oxygen that will be that will assist in metabolism, which is energy production. But if you find the blood vessel clogged up with fats, then the percentage of oxygen that gets into that cell is lower. With that low level of oxygen percentage, then energy production here is also lower. Eventually, that cell, you'll find it looking like that instead of this. This is a weak cell. This is a worn-out cell whose cell wall is hard. That even flow of oxygen, you say, is poor, and carbon dioxide plus other waste products of metabolism is also poorly excreted from that cell. If your cell is here, then cholera is coming for you. If your cell is here, that immunity is low. That you are prone to getting diseases and infections here and there. How best can we sort out this cell from being there to this? That's why we are here making this noise and see if somebody will listen and follow what we are telling them. But even if they don't follow, not a problem. Mimi na cholera hatutapatana. Backache. I've always said that the fact that you have a backache, it doesn't mean it is your bones that have an issue. It's your cartilage that has an issue. No, we could be having other issues. We could be having other organs that are affected in the system, which will make us, which will present with a backache. Lot of hair loss, what we call alopecia. If you find you are losing hair at an alarming rate before ufike ile miaka ya nywele kutoka, then there is a problem. BF Suma has a solution to this. We have quite a number of products that we give you so that we are able to protect that body. We have a series of coffees, and these coffees are made in different ways. Number one, we have what we call SSC coffee. Of course, the SSC coffee. We've got various varieties. The first coffee that we have is what we call reishi coffee, which consists of a mushroom cap and a mushroom stem. It contains rich nutritional value, including ganoderma. For those who know reishi coffee has got some ganoderma in it. Reishi coffee. This is how it's packaged. And there are 20 sachets. Wakisiwangu, sio sachet. Leta sachet ya roiko, sio sachet, ni sachet. 20 sachets. Wakisi leo mnashaka. Yeah, 20 sachets, they're in there. That is reishi coffee. And its work is immune boosting. Why? Because it has got some level of ganoderma in it. Enhancing immunity and replacing, immune boosting, protecting the liver. Why do we talk about the liver? We talk about the liver, and of course, when we are talking about immunity, it's important to mention some key organs here. We mention about the liver because the liver, that is where energy production will be in its numbers. We talk about Joto will be produced by the liver. And if the liver is compromised, then even energy production is low. If the liver is compromised, detoxification, that act of cleansing of blood will be poor. Because we know blood will circulate throughout the body. Blood is what will pick waste products of metabolism. Zile takataka ambazo zitatoka kwa zile cells ambazo ziko worn out. Na itatembea na damu hadi ifike kwa maini at the liver level. At the liver level, that is where that blood will be cleansed. Upon cleansing, the blood will be oxygenated. Itapata hewa safi, and then it will be pumped by the heart, the rest of the body, to continue doing what it does best. Therefore, the liver is a very important organ in our body. There are those of us who are going to die today. I hope you've done like a small letter to your, a small SMS to your liver. Mwambie, Mr. Liver, today is going to be slightly bumpy. Please bear with me. Lakini nitajaribu kukunyunyuzia maji. Yaani kunywa maji. Kunywa maji, ukimaliza kunywa tembo. Mimi sijakunywa tembo. So, reishi coffee, we have said, very good in immune boosting. We also have a coffee called ginseng, which contains chemical substance called ginsenoside. Who can mention that? Which has obvious efficacy in regulating the central nervous system, strengthening the heart muscles. Look at strengthening the central nervous system. The other day we were discussing about nerves, and then we asked, when you say you are emotionally, you are unstable, you say you are nervous. Nervous. What's another term we use for those who attend these classes? You are anxious. Why the anxiety? Why the nervousness? It means the nervous system is affected. It's another day that we discuss about the nerves. Now, today we are looking at ginseng. Then, strengthening of the heart muscles. We have what we call the myocardia, which are the heart muscles that will help in pumping blood to the rest of the body, and also the nervous system. And that's why, its main efficacies, anti-tumor activity. We look at anti-tumor when we're looking at apparent broken ganoderma spores and rich and refined using. Also recovery after illness, enhancing physical strength. The physical strength is enhanced by that CNS, the central nervous system, work on to help that blood vessel pump blood to the cells of the body so that energy provision is there. Regulating hormones. We know we have hormones that govern how our body functions, controlling blood pressure and liver function. But again, this is why I give ginseng to the boy child, especially when we have our reproductive system issues. We want blood flow down there nicely. Okay, one friend of mine sent me a photo of products that a certain client was taking, and in those products, of course, there was something that helps in pumping blood. That one is Reiki. It's prescribed, what we call the blue pill. The way the blue pill works is to help in pumping blood, making the heart muscles to pump blood so that it goes down to the third leg. If you know, you know. After going there, we know what we are going to do. So, ginseng also works in that manner. Palpitations. But otherwise, it is one of the best coffees that any boy child in here, ikiwa hautatoka na pure well, basi toka na ginseng coffee. Ikiwa umepewa ginseng coffee, thank me later. Ikiwa hujapewa, whoever invited you here, if they have not given you a coffee, please come and report to me. It is bad manners. I've always told them to take care of our clients. Cordyceps. It's not a grass. Of course, it looks like a grass, but a fungi. It is a worm in winter and grass in summer, also called winter worm, summer herb. And its main work, of course, as a famous tonic, cordyceps contains rich cordycepic acid, fat, protein, etc. It is suitable for relieving symptoms of lung discomfort. Those people who are complaining about asthma, chest issues, lung issues, cordyceps is the coffee to take. It is very good, and also, of course, that tonic, we know what tonic is used for. Tonic is like a very good drink. Of course, I do not respect carbonated drinks, but the tonic bit of it is very good in cell repair, refreshness here and there. Therefore, for chest issues, coughing, asthma, cordyceps is good. Yuzi, refined yuzi, one of the best products that you should not leave here. How does it work? The target group, those who are frail and get fatigued, those chronically ill and with low immunity, and also middle age and elderly aging bodies, and adult female pursuing body balance. When you are talking about body balance, we are looking at your hormonal functionalities, that your body is governed by hormones. And these hormones will be produced by different glands in the body. So with hormonal imbalance, me and you know that life will not be as sweet as expected. Refined yuzi is the way to go. That it improves that immune function of the body and relieving what we call leukopenia, that is low white blood count. We know the white blood cells are very intelligent. That's why God gave them that work of zunguka ndani ya mwili as they look for toxins, which are disease-causing agents. It could be viruses, it could be whatever it is. Refined yuzi helps in leukopenia, relieving leukopenia. In other words, boosting generation of white blood cells, which will protect the body, and that's what we call immunity. Elevating side effects of chronic diseases treatment, and improving mental and health status of patients with chronic diseases. Of course, these people will always have issues, mental, especially when they have these chronic conditions. These are the people who will be looking at a grave. I told you the other day that one time when I fell sick, Of course, I'll be talking about using and what you call pure and broken canoderma spores. My illness was COVID. When COVID was COVID, what does I hear? Nilishikwa na COVID. Wakati wetu haungetaka kujua, haungetaka ujulikane huko na COVID. Mimi ile na nilikimbia nikatafutwa nikawekwa mateka na nikapelekwa ndani. Kupelekwa huko, my mental status, you know, I tell people, by being a medic, me injecting you would take me 30 seconds. But you injecting me, we will have to discuss, sit down and talk. Okay, not because I cannot be injected. I have some soft parts that can be injected. But because I am whom I am. You know, the way we were made. Wewe kukupatia ni haraka lakini mimi kutumia is a problem. So, we are talking of these patients who will have issues here and there. You know, psychologically, when they are sleeping there. I'm sorry if we have anybody here with such a condition. These are people who have been given diagnosis by doctors. And they're looking at themselves, they're wondering, hey, will I ever make it to see Christmas this year? Will I ever make it to see 2024? Yes, there is hope when it comes to Suma. These are the people that I want you to talk to. I know we've been given holidays. Kuna wale ambao tutatoka hapa saizi, tunaenda Kenankofu. Kuna wale tunatoka hapa, tunaenda Githunguri. Kuna wale tunatoka hapa, tunaenda Ogembo kwetu. Kuna wale tunatoka hapa, tunaenda Katwenzeine. When you go and meet those relatives who have been given diagnosis and they've been told you may not live to see June this year, then talk to them. Tell them, yes, refined UZ will help them, you know, pick up the white blood cells, which will help in protecting their body system, and even that inflammation will also be reduced. Reduce side effects of chemotherapy, such as nausea, loss of appetite, hair loss, what we call alopecia, ule kupotea kwa nywele. Remember we say that if you find that you have abnormal hair loss, then that is a direct indicator of a low level of immunity. Appetite is very important so that you can eat. And what is appetite? You see, some of these definitions, we need to look at them practically. That if we have a cell of the body, I'll still go back to my cell. And that cell has got all those things that we said in there nicely. And the blood vessel there, yes, the blood vessel there is healthy. That exchange of nutrients, exchange of gases is good, then this person's appetite will be fine. But if you find that cell looking like that, and that blood vessel portion is weak, this person's appetite is poor. Because the cell in here, again, it can be very good or very bad. This cell is deprived of nutrients, and it wants nutrients. You feed it wrongly, it continues aging and getting worn out. But this one is fine, it's comfortable, psychologically iko sawa. Miguu ya tatu iko sawa, if you know you know, plus every other thing. But with this one, it is quite wanting, it is weak, even oxygen production is low. This one we say that suppose this cell is in the brain, and we know our sleep will be controlled from up here. We have glands up here, what we call, we have the pituitary gland, the pineal gland, which will secrete hormones, like now hormone serotonin, which is the sleep hormone. If this cell is like this, then when we are up and about, we are doing our things, oxygen uptake, the percentage, for example, instead of being, say, 100%, utapata at least kako 65%. Sa hiyo tunatembea. But when you go to sleep, most of the activities have gone down. That cell is still doing what it's supposed to do. The oxygen levels that will go in there will be, say, 30%. This is when you'll find yourself snoring. Hapa ndio unapiga kelele ukilala. You are trying to pull in what? Oxygen in there. This is when your quality of sleep will be very poor. Unalala ukiamuka, ukilala ukiamuka, ukilala ukiamuka. Ile unaamuka nawaambianga unaamuka usiku na what are you doing? You are trying to chew oxygen so that it goes in there to help in the cell functioning. That's why you will not sleep. But if the cell is okay, oxygen uptake from the lung tissue is okay, it is B12 taken to the cell okay, even your quality of sleep is nice. Hapo tunalala usingizi wa vono, sio usingizi wa mangamngam. Mangamngam ni ile kelele unapiga kama nam. Walimu wa Kiswahili, malenga wa Kiswahili, sija define mangamngam, mtanikuia radhi. Then calming anti-inflammation and accelerating post-operative wound recovery. That wound, a wound is an injured tissue, maybe because of operation, maybe because of an injury, whatever it is. Then we want that cell to recover well, we want that body system to recover well, hence the post-operative wound recovery will be good. Improve blood circulation. When blood circulation is fine, of course, energy production, oxygen will reach the sites of the body properly. We have a super immune booster called pure and broken Ganoderma spores, which is made from some special type of mushroom right from the virgin lands, what you call the alpines. That the spores, Suma is the first company to obtain a spore. A spore is a seed. You can imagine it is what? It is you cannot see it by your bare what? Eyes. Bare eyes. That Suma has been able to obtain that spore and broken it, put it into a capsule and brought it to you here at Utumishi Cooperative House. That's why it's called pure and broken. In summary, boosts immunity, inhibit tumor, prevent cancer, regulate blood sugar, control blood pressure, and promote sleep quality. That's what I was talking about there, promoting sleep quality. That product made me look at certain studies that have been done. That a medical research that in 2014, Ganoderma was found that it can block the release of anaphylaxis media and prevent occurrence of anaphylaxis. Anaphylaxis is a severe, potentially life-threatening allergic reaction. That reaction can be quite life-threatening. Why? Because we can have skin reactions, nausea, vomiting, weak and rapid pulse. That is ile mipigo ya moyo ambayo itasukuma damu, dizziness, fainting, and even breathlessness, shock. In other words, we can easily have our what we call it, our respiratory organs collapsing. When it collapses, of course, me and you will not be able to breathe well. Ganoderma was able to prevent that. And when we look at that university in Japan, 2015, that Ganoderma terpenoids can resist influenza viruses. I know rotavirus is giving our people hard time, but especially the kids. Influenza viruses, the flu attacks the lungs, nose and throat, and it's spread by airborne respiratory droplets, coughs and sneezes, by touching a contaminated surface, by saliva, skin to skin contact. Think COVID. I did this small reading in my COVID bed. Those who know me well, you know my small story. In my COVID bed, when I was looking at what is Ganoderma and how best can it help me in my state. Power of nature, rebuilding immunity. That pure and broken promotes metabolism. Metabolism is energy production from that cell. Delay aging and preventing cancer. How does it prevent cancer? We'll look at that. Ganoderma acid has specific cytotoxic effects on tumor cells. Somebody went training wrongly somewhere. For those of us who will go other places for training that we don't recommend, and they were told that yes, if that product helps in regeneration of tissues, how is it not supposed to worsen a cancerous cell by improving its functionality? No, because Ganoderma acid has specific cytotoxic effects. Cytotoxic effects are harmful effects on tumor cells, directly killing tumor cells and preventing proliferation. That if we had a cell in here, for example, we have that cell of the body and we have some other cells. Okay, let me use this cell of mine here. That this cell, you see, is worn out. That this cell is prone to any disease. How will cancerous cells form in there? We looked at cancer the other day, last week, and saw that it is a good cell of the body that undergoes some genetic changes. Upon undergoing those changes, it uses good environment in the body and starts dividing abnormally. With abnormal division, that cancer starts growing. I normally give an example of what we call the water hyacinth. at our lovely Lake Victoria. Those of us who are from Nyanza in the house, Sema Oyea. Thank you. Umesikia Nyanza house. That those cells start dividing abnormally. With that abnormal division. Why? Because the cells are growing in an environment that suits them, an environment that they are happy with, an environment that cannot be reached by those cytotoxic cells. Therefore, they start dividing abnormally, and that cell at some point, it can move from this bad cell to another cell, what we call metastasis, that moving of cancerous cells from a bad cell to a good cell. But if those cells are in here, for example, and they are threatening, why are they there? Because this cell wall is hardened. And when the cell wall is hardened, we say toxins and waste products of metabolism are not able to move out. When they are there, they start ganging up. With that ganging up, they utilize the nutrients in there, and genetically they are changed, hence they start growing abnormally. Eventually they'll be given a name cancer of a given part of our body. So when the doctors will be treating, they'll be treating those abnormal cells through targeted therapy, through chemotherapy, through whichever types of therapy, so that they can curb it. Unfortunately, you'll find that some of these cells have moved to this other cell. That's why we bring in pure and broken ganoderma spores, which has got very specific cytotoxic effects on those tumorous cells, and help by engulfing and destroying their functionality to prevent proliferation. In other words, from growing and spreading to other parts of the body. Haki ya Mungu, ikiwa mtu hataelewa hiyo nimeexplain, basi wacha nirudi Kisii niende kuchunga kondoo. Activating immune cells and accelerating the production of body antibodies. Unawaka moto? Sunday John, enda akupatie chaja yako ya simu. Sunday John, enda pale kwa Susan anakuita. Yeah, we are saying antibodies. That antibodies are the ones that will fight against disease-causing cells. Antibodies are soldiers in the system which will work with white blood cells, protecting that body against those conditions that will come in and destabilize it. Therefore, by activating the immune cells, then the body is well protected against these conditions, against illnesses, and that is how it boosts immunity, curing cardiovascular diseases and preventing and aiding treatment of coronary heart disease. Coronary arteries are blood vessels supplying the heart muscles, and when the heart muscles are not richly supplied with blood, then oxygen and nutrients will not reach the heart muscles, hence the heart will not pump blood to the rest of the body. When blood is not pumped to the rest of the body, even the food that we eat, which will be absorbed and taken into the bloodstream, will not be taken to the sites that it's required, so that repair of body cells will happen. Angina pectoris, atherosclerosis, that is hardening of the blood vessels, hypertension, hyperlipidemia, and others. Accelerating cure of cold and reducing risk of inflammation. Inflammation ni kuchubuka kwa zile cells za mwili. Relieving insomnia. Insomnia is lack of sleep. Ule kulala, ule usingizi wa mangam-ngam. Mental tension and what we call psychasthenia. That at some point you find your instability upstairs. You are so unstable. You are nervous. You are what else did we call it? Anxious. You are anxious for no good reason. Hata Biblia inasema msiwe anxious kwa sababu Bosire yako Bosire yako hata wakati nimevaa suti mpya nobody recognize. Sawa tu. Tuendelee kazi. Boosting metabolism of the digestive system. The digestive system starts from the mouth to the anal area. That if metabolism, if energy production is good there, then that digestive system will help in absorption of nutrients that will go into the system and help us. And obvious therapeutic effects on hepatitis. Hepatitis is inflammation of the liver. And we say all blood passes through the liver for detoxification and re-energization. Gastritis, diabetes, chronic renal failure, and other diseases. I've always bragged around that I took medication, diabetes for 4 years. Now hypertension, almost 4.5, if not 5 years. The cells of the body were repaired from there to here, courtesy of Pure and Broken. And also, as I said, when I was down there nursing myself and being nursed with COVID, Pure and Broken, BK, my mentor, I told you guys I'm being mentored by a lion. So I have to be a lion cub, by fire, by force. Without which, the lion, itaona haijafanya kazi. I told, BK called me, and I remember I was at home. You know, I was in my clinic. Nikamuita Obagosi, akakuja. Now, I am in the clinic, and I have some small job to do here. Somebody had brought in some 2-3 boys who are supposed to be tengenezwa, you know what I mean. Nikamwambia Bill that I'm not feeling well. So what you do, you tengeneza those boys called anesthetist so and so tuwatengeneze. So Bill that akaendelea. So after receiving that news, I decided to go to a hideout. Nikajificha na ili nisije nikakamatwa nipelekwe prosta relax. Akanambia yeye itakusaidia. Akanambia anyway, when PK realizes that you are dragging, he thinks very fast na anakugonga. So akaniambia okay, I'll call you back. BK went to the counter, picked I don't know how many number of Pure and Broken, refined, using, name them. Kila kitu akaeka kwa mfuko. And he found his way to Tulip, but he could not be allowed in. Akasema kuna mtu napelekea. He called me, nikamwambia PK, my code is C17Y J. Akaandika hapo C17J, akawapatia. In 2 minutes ilikuwa imefika, nikapiga picha nikamtumia. And in it we had Pure and Broken. But because of that mentality in me, remember I was diabetic, I was hypertensive, and somebody had mentioned in the media that people who are diabetic and hypertensive, COVID inawalamba namna hii kama glucose. Wazazi, unajua vile watu hizi hii wanaramba mchele kama glucose. Kwangu nikienda nikipata mchele nitajua jimia wajakula. So COVID ilikuwa inatulamba. Nikajua hapa nimelambwa. That is when I told Mercy the truth. Nikamwambia Mercy, I have an account with Diamond Trust Bank, and the ATM. Unajua diary, who has a diary here? Yes. Nikwambie wanaume tunakuanga na upuzi. Nilikuwa nimekata kadayari hapa na nikaeka huko ndani. Nikafungia. Okay? Nikamwambia and the password is this. The pin is this. Within 2 hours niliona message. Kodom basi ametoa 50. Ikasema COVID walilo 50,000 zimeenda. Nikamwambia haki baba mbona jani mbona unaenda ikumwenda ni mimi nitakunyoka. But there's nothing I will do. It will not even buy me a coffee because government get